All right, so how do we classify psychological disorders? This is something that's one of the biggest issues we had was how do you create classifications for mental illness? Is there value of talking about diagnosis instead of just talking about individuals? And so this is something that, psychologists have been working with and have been trying to adapt and change and kind of solidify for many, many years. Okay, so one of the reasons why we do this is because diagnoses create a verbal shorthand for referring to a list of associated symptoms. Diagnoses allow us to statistically study many similar cases, learning to predict outcomes, and they can guide treatment choices. Okay, so what is it that we use? Well, we have something called the DSM, the Diagnostic and Statistical Manual. Make sure you remember this abbreviation, the DSM. Okay, and so it's easy. For instance, it's easier to count cases of autism if we have a clear definition. Okay, there are lots of different revisions. I think right now we're on the fifth revision. It just came out in the May 2013. Okay, and the DSM is used to justify payment for treatment as well. So it's also an insurance piece, and it's consistent with diagnosis used by medical doctors worldwide. So it's one of the other things that was really important is that it opened it up to consistency around the world. So how does the DSM work? Well, the DSM suggests describing someone not just with a label, but with a five-part picture, and we call each of these parts an axis, okay? So axis one is there a clinical syndrome? Okay, and the clinical syndromes are the things that you're used to hearing: schizophrenia, mood disorders, bipolar disorder, those types of things. Axis two is a personality disorder or mental retardation or intellectual developmental disorder present, okay? So you can select, you may or may not have one of these, or you may have one or two of these. Now, again, we separate personality disorders out for a reason, and we'll come back and talk about that when we talk about personality disorders. And we also want to make sure that we separate out any kind of intellectual disabilities because of the effect that it may have on diagnosing one of the other axes. Okay, axis three is there a general medical condition such as diabetes, arthritis, or hypertension also present? Okay, now again, the understanding a general medical condition is important because just as syphilis, it gave us this insight into the fact that, advanced syphilis causes these disorders, then we can start to find if there's an underlying cause that could be treated through a strictly medical way and not necessarily in a mental health way. Also, drug interactions are important. So axis four, psychosocial and environmental problems such as school or housing issues, are those present? And then lastly, we have something called a global assessment on axis five, and this is the person's functioning, and you get assigned a code from 0 being 100. Okay, 100 is good, 0 is bad. So really make sure that you understand and you can identify and describe each of these five axes on the DSM. And we're going to talk about these in a lot more detail in class and go over some of the importance of each of these. Okay, but it's really important that you understand and can identify all five. Now, what are the category on axis one? Okay, so just kind of, this is just a brief little kind of like the table of contents from the DSM. So disorders usually first diagnosed in infancy: delirium, dementia, amnesia, substance-related disorders, mood disorders, anxiety disorders, somatoform disorders, fictitious disorders, intentionally faked ones, sleep disorders, all these different things, okay? And again, we're going to come back and talk about all of these things individually. But again, so on axis one, you would get a diagnosis somewhere in this realm. Okay, now what are some of the critiques of diagnosing with the DSM? Well, the DSM calls too many people disordered. The border between diagnosis or between disorder and normal seems kind of arbitrary. Decisions about what is a disorder seem to include value judgments, so is depression necessarily deviant? Okay, and diagnostic labels direct how we view and interpret the world, telling us which behavior and mental states to see as disordered. So these are some of the things, the issues that people have with kind of having this wrapped up book of the DSM. There's also the issue of stigma and stereotypes. Many people think of a diagnostic label as meaning tainted, weird, weak, or something like that. So because of this, psychologists believe that we should use extreme caution in diagnosing and labeling. However, these negative views oftentimes come from pop culture, not necessarily the DSM. Okay, and the DSM may contain the information to correct inaccurate perceptions of mental illnesses. So, popular culture kind of is the thing that creates this stigma, and maybe if people had a better understanding of the DSM, those stigmas wouldn't exist. Now, what about insanity? Okay, so insanity and responsibility are always something that comes up, and it's an important thing to acknowledge and recognize. So this is Jared Lautner, who shot many people, including a U.S. representative in 2011. He has schizophrenia and substance abuse problems, a combination associated with increased violence. So the big question is, to what degree, if any, should he be held responsible for his actions, and what is the appropriate consequence? So insanity is an interesting thing because it's actually more of a legal definition, and it talks about this idea of knowing and not just knowing the difference between right and wrong, but even understanding that there is such thing as right and wrong. So insanity and responsibility is a really kind of interesting conversation that we're going to be having in class. All right, so again, the key thing to make sure you understand from this is you need to know the 5 axes of the DSM.